Hi everyone, hope you guys are doing good today. Today marks the start of Feeding Tube Awareness Week. So throughout the week, I plan on doing some more videos to teach you guys about that. Feeding tubes are used for multiple purposes. They're used maybe for disease, such as gastroparesis, which is what I have. The stomach is paralyzed. Anything I intake orally doesn't get digested, and so I don't get nutrition from that. There are people who have certain conditions. It causes them too much pain to chew, or it causes their esophagus not to work properly and they can't swallow, so they get feeding tubes. Some cancer patients can get them. They're used to help in eating disorder recovery. There's hundreds of reasons why a person can get a feeding tube. Today I just want to touch base on the type of feeding tubes that there are, and then later on in the week, get you more acclimated with setting up feeding tubes and setting up feeds and things like that. The first types of feeding tubes that I want to talk about are nasal feeding tubes. These are used more on a temporary basis to make sure that the patient will tolerate their feeds, and then they'll go to a more permanent feeding tube like the ones in the abdominal wall, or if only the patient needs the feeding tube short term to gain just a little bit of weight, then they can remove it. What this does is it goes in through the nose, and most people are wide awake when this is done. And as they're putting it in, you're drinking. Usually they'll have you drink some water, so you just continue to swallow, and it'll go down and through your throat and into your stomach. If it ends in your stomach, the feeds go into your stomach. So that would be more for people who have trouble swallowing, trouble chewing, things like that. The second type of nasal tube actually goes past your stomach and into your small intestines. And everything goes into your small intestines. That's ideal for people who have stomach issues, such as gastroparesis. With the nasal feeding tubes, like I said, they're very evident. It comes out the nose, and typically people will tape it to the side of their cheek to keep it out of the way, or wrap it behind their ear and connect the tube that way. The abdominal feeding tubes, there are 3 different types. The first one is a gastric feeding tube, and again, that goes straight into the stomach, and you hook up the feeds, and it's continuously going into the stomach. The second one is a jejunectomy tube, which is a surgical tube placed through the abdominal wall right into your small intestines. And that's again for people who can't handle anything in their stomach, and so that has to be bypassed and be absorbed by the small intestine walls. The third type of abdominal wall feeding tube, it's a GJ tube. It's a combination of the two. It goes in the abdominal wall into the stomach, and once it's in the stomach, it splits. A portion of it just stays there for the stomach, and a portion of it goes into the small intestines, a longer tube. This is a helpful feeding tube for people who have issues with constant vomiting, but yet they can't handle anything in their stomach, such as me with gastroparesis. I do have a GJ tube, and so I hook up my feeds to go into my small intestines, and days that I'm really sick, where I feel like I'm going to throw up, I can actually use the G portion of the tube to empty my stomach to avoid throwing up. It's very, helpful, because when you're throwing up, the bile is eating away at your esophagus, eating away at your teeth, and, it can also cause hernias. Vomiting's not fun, so that's an easy way to bypass that. For all those tubes that I just talked about, there are special types of formulas, and there's so many type of them, but it's pretty much, most of them come pre-made, and you can think of it looking like baby formula or something, but it goes in a bag. That bag goes through a pump, and that pump slowly pushes the feed into your system. Some people can't tolerate high rates, other people can. The rate of the feed is just per individual, and that's something more that we'll get into later this week. The other type of feeding tube is done through IV nutrition, and that's called TPN, Total Parenteral Nutrition. And what it is it looks like a really big bag of IV fluids, but within that there can be lipids, there can be constant vitamins added, things like that, and it gives the person the same nutrition they'd be getting from a feeding tube, but for some reason they're unable to have the feeding tube, so they're put on TPN. When they're put on TPN, there's a few ways that it can be given. They can be put a PICC line through the arm, which is like a permanent IV that sticks out of the arm, and they use it that way. It can be done through a port, which I have a port. This needle actually gets changed weekly, so it's a little different from the PICC line, because the PICC line you don't change it at all. You just change the dressing, and it'll go through this. Or they do central lines on the chest, kind of like a Broviac line or something like that, and it goes in the chest, and it's permanent. Like the PICC line, you wouldn't be changing the needle or anything like that. The big thing with these lines are they lead directly to the heart. So you gotta be very careful, take as many precautions as you can. You don't want to introduce any bacteria into these lines, because it goes directly to the heart, and that can make an infection, can make a person really sick and could cause death. Those are really all the ways currently that people are fed. If they're unable to give themselves nutrition for some reason or another, if you see someone that's on a feeding tube, don't stare. Go and ask. We're all willing to explain why we have a feeding tube, how it's helping us, things like that. I've had mine for about a year now, and it's saved my life. And without my feeding tube, I don't know where I would be today. It helped me gain 20 pounds out of the 50 that I lost from my disease. It's given me more energy. It is a love-hate relationship, because of course I don't want that there, but it's better than the alternative. So, again, like I said, don't stare at people who have one. Feel free to go up and nicely ask them about it. I've had instances where girls that I know who have a nasal feeding tube, they'll have people come up and say, "What's that coming out of your nose?" And just go up to them and be like, "Hi, how are you? I noticed, you have this tube, what is it for?" Or even feeding tubes or PICC lines, you'll notice them, because we have to have them with us. We have a backpack, there'll be a line hanging out of it, and that's something more that I'll touch on during the week, but, that's what Feeding Tube Awareness Week is for, so that we can teach you guys what it's like to have a feeding tube, and so that more people know, that line is not something dangerous, that line is not something to play with, it's something that's needed. Other than that, on Tuesday, I plan on having my friend Tori do a video on TPN, because she is on TPN, and tomorrow I do plan on showing you guys how I set up my feeds and get connected, and a few more things throughout the week. So if you have any other questions, please feel free to let me know, and I will try and get them addressed as quickly as possible. Thank you.